Hello guys, today's topic is atrophic rhinitis. Ozini. Atrophic rhinitis is also called as Ozini. Today we will get into, we will cram atrophic rhinitis. It is called as Ozini. It is progressive atrophy of mucosa, submucosa, underlying tissue, underlying bone. It is atrophy of turbinates. It is atrophy of turbinates. It is more common in female. Atrophic rhinitis is atrophy of mucosa, submucosa, underlying tissue, underlying bone, everything inside the nose. It is a disease of the nose. It is atrophy of the mucosa of the nose, submucosa of the nose, bones of the nose, and it is more common in females. What is the etiology? There are four factors: autoimmunity, vitamin D deficiency, estrogen deficiency, infection. Infection is usually Klebsiella ozeni. What is the etiology of atrophic rhinitis? It is autoimmunity, vitamin D deficiency, estrogen, infection. Autoimmunity, vitamin D deficiency, estrogen, infection. Now what happens? Crest formation occurs. It is dried mucus. When there is atrophy, mucus dries, forms crest. Atrophic turbinates atrophy. They form the cresting inside the nose. On examination, we find atrophied turbinates. We find big roomy nasal cavity, but it is filled with crest. And due to increased airflow, when there is increased airflow, there is cresting of the nasal mucosa. When the crests are removed, nasal cavity is very roomy. We have nasal blockage. It is due to crest. Otherwise nasal cavity is very big, but there is nasal blockage. What is the reason of nasal blockage? Cresting. Bad smell from patients. When patient comes to the doctor, patient has bad smell. What is the cause of the bad smell? Infection. And what is it called? It is due to cresting. It is due to cresting. Patient has no sense of smell, because there is atrophy of nerves also which take the smell. So this is called merciful anosmia. Patient has bad smell in the nose, but he cannot smell it himself. It is called merciful anosmia. Treatment of choice: alkaline nasal douching. What is the composition of alkaline nasal douching? Sodium bicarbonate, sodium bicarbonate, sodium chloride. Sodium bicarbonate 1 pot, sodium bicarbonate 1 pot, sodium chloride 2 pots. So out of 4 pots, 2 sodium chloride, sodium bicarbonate, sodium bicarbonate. We have second drug, chemistine anti-ozeni drops. What are the contents? Vitamin D, estradiol, chloramphenicol. Vitamin D, estradiol, chloramphenicol. Chemistine ozeni drops. Vitamin D, estradiol, chloramphenicol. 25% glucose in glycerine. Nasal drops, 25% glucose in glycerine. Nasal drops. This is the third method. So it is 25% glucose. It is bactericidal. Glycerine, it is hygroscopic agent. Then we have treatment is surgical treatment is modified Yankees operation, partial closure of both nasal nostrils. We close the nostrils partially. Then we have second operation. It is called a Lawton stagger operation, medialization of lateral wall. Guys, thank you. This is the end of atrophic rhinitis. We read atrophic rhinitis. Main points are: it is atrophy of nasal mucosa, submucosa, underlying bone, more common in females. 4 causes: autoimmunity, vitamin D deficiency, estrogen deficiency, infection, Klebsiella ozeni, merciful anosmia, alkaline nasal douching, chemistine anti-ozeni drops, 25% glucose in glycerine, surgical Yankees operation, Lawton stagger operation. This is in a nutshell. Thank you very much. I am Dr. Parvez. Please like and subscribe.